And
Nice to meet you
same
as well.
for you. Thank you. And what I'm going to do is I'm going to spend about 5-10 minutes just showing you a couple basic things that you really need to know to be able to get into the system, find a client, open a clinical note, prescribe a medication, and basic workflow of doing just those simple functions. Then I'll stop, make sure you're okay, we'll ask some questions, and we'll just spend like the next 45 minutes making sure you're comfortable finding clients, opening charts, doing notes, prescribing medications. Sound good? Okay. So a couple things for new users. Little tips and tricks of things that happen. Everybody will have a little login to log into your database. When you log in every time, you have to click this yellow button. If you skip the yellow button, what's going to happen is it doesn't connect you to the database. So a lot of our clients, the users try to do a quick cheat sheet and they try to bookmark this blue page. Don't do that. Always start from the main link to go through the process of clicking the yellow button. It connects you to your database. Then you can put your username and password in. So I'm just going to put a test doctor password in. You will not need to do this second layer. You won't ever see this. This is just for my team at ADS so I can see who goes into your database. So we audit all of my staff's use in your system. Now, when you log in, there's a couple different default views that you can have. This default view for me is set up as the scheduler. So I'm a medical doctor. I've scheduled appointments. Everybody for today that I need to see or do a visit for or a medical encounter, I can see all of my patients for today. So this would basically be my schedule. So a lot of our clients, if you're outpatient based and you're doing medical services, they want this to be their default page. But if you don't work off of scheduled appointments and basically what you're doing is you go in, you find a client and you just want to go into their chart to do work, the central hub where we have been pointing everybody to start their day is on the left-hand navigation bar. So the left-hand navigation bar is basically your Doc Assist version 7, your current version. And most of the wording is the same, but basically to go to My Documents, to sign and bulk sign your encounters, like all that stuff is the same. You just access it from the left-hand navigation bar. That's the big change in cloud. So when you log in, just open up your left-hand navigation bar to start your day. And the first one I want you to know, which is the central hub for all users, is something called patient programs. Patient programs is just a list of all the active clients that are currently in your facility being treated by your staff. So this is sorted by every location, every program, and at the top is a search bar. So let's say I want to find, I know Mark Patrick had put a test patient in the other day. So the test patient's last name was his last name with a Z in front. So it was Z Patrick. If I search Z Patrick and just hit the search bar, I can see here is my client I either want to do work on or that I want to review old charts. Once you find your client that you want to do work on, if you click on the silhouette, so if they uploaded a picture, it'll actually be their picture. If not, it's just a black headshot of the client. And if you click that headshot, what it does is it opens the client timeline. This is basically everything that's ever been done. So the patient programs on the left-hand side is where we go to find clients, review old charts, and then jump into their chart to do some clinical documentation, or as I say, do work. And if you just want to review, click the little picture. If you want to go into their chart, click the link underneath it that says the program name, and it's going to open up their chart so you can start to do some documentation. Okay? So we're going to start in patient programs. Do either of you have any questions about that, or does that all make sense?
Got it.
Okay. Now, if I want to review, this is something new in the cloud. This is called the patient timeline. The patient timeline gives you all the demographic information as well as the program, if there's a diagnosis code, their admit date, anything demographic related, level of care, programs is all at the top. So this is the summary of this client. Below is all the encounters we've done. So this is basically just the timeline of every clinical note, when they were put into a bed, what day they were admitted to the program, what was the last encounter. These are all generally done chronologically. And if you look, this first one, a treatment plan encounter, was done on 9/21 at 2:45 by Dr. Mark Patrick. Okay? So that's how you read this. And if you want to review it, you would just click on these little links here, and it actually pulls the encounters up right into the screen. So this is a quick way to find a client. Go find whoever you want to look for. So I'll just find a different client, test. Search all my test clients. I have three in detox. I have 1 in MAT. I have tons in outpatient. So I'll just take my MAT program, click on his face, the silhouette. I can see that we did 1 encounter, which was a medication encounter. All these are just little admit and discharge time frame points that happened the last time we worked with them. And at the top is all of his demographics. Basic fundamental, what is the home screen like? If I'm not using scheduled appointments, my home screen, find all your clients from patient search. Or I'm sorry, patient programs. Okay? Patient programs right here. If I want to go in and do work, you can click the navigation bar, and that's how you're going to access the client's chart to do medical encounters, biopsychosocial, psychiatric assessments, psych eval, psych follow-ups, medication encounters, anything like that you generally do in your day. To go into the chart and open an encounter, just link the bottom link, and then you can start to do work. So what I'm going to do now is I'm going to go back to Mark Patrick, and I just do this so you get a sense of how you really navigate the system. Let's say we're going to work on Mark Patrick today, so I know he has his name as a Z in front of it. So I found Z Patrick. I click on his link, review where he is, what program he's in. That's just additional demographic information that pops up. I want to review the last medical encounter or treatment plan. I go, great. If I want to do work, I click the little link underneath, open it up, and now his chart's open, and I can start to pick encounters that I may want to do. So the timeline follows you everywhere. So if you're ever doing a note and you want to review a previous note while you're working on the note that you're doing today, you can open up any of these notes over here on the side just to reference old documents. Okay? Now, when you come into the chart, because I did it from patient programs, I didn't pick the encounter that I want to do. I didn't tell the system what I wanted to do. So all it did is just brought me into his chart. Now I got to decide what type of note I want to do. So if you click the All tab, the one that's orange, which it's recommending you click, this is a list of all your encounters that we copied over from your current version that you can basically access to do any type of clinical note. So, for example, I'm just going to show you how to do a note, and then we'll talk about a couple that you guys might do. Specifically, all I'm going to do is open up a medical encounter. I'll click on it. To do a new one, you hit the plus sign. Okay, it'll always open the last one that you did at the bottom, but I want to do a new one. So I'm going to hit the plus sign to do a new encounter. It's going to ask you if this is you, if this is the location that you're at. And this is here for you guys because you guys use this admission, the visit type, and the action taken. So this is specific to your organization. And then you can start doing your clinical note. So now you'll see your clinical note at the bottom, which I can scroll through. Okay, and I can put any documentation in. Your notes at the bottom, all of your clinical encounters are at the top, and the timeline is on the right. So that's the basic orientation inside the client chart in cloud. And I just want to know, do you guys have any questions about that?
No.
Okay. Am I going too fast? Is it hard to follow, or am I going at an okay speed for you guys? Okay. I'll assume that means okay. So when you guys are in the clinical notes, you can go in and just type away in any section. So you can scroll through, answer your sections, past medical history, social history, family history. You can add allergies and current meds. So if I just click the little blue pen, it opens up the database so you can use the e-scripts and order controlled substances, add current meds, things like that. So if I wanted to add a current med, I would click the little button that says add current med. Let's say we're going to put the client on lovastatin. This would just be for a current med, and we'll just say it's 1 time a day, and we'll hit save. All right? And basically what I'm showing you is how you navigate an encounter. So family history, I can free type if I want to type. If I click the blue pen, there's a template that drops. So the blue pen just means that there's templates behind it that are yours that you can select if you don't want to free type. Okay, so this is just how you go through and do a note. You can put comments in, and then you always have to hit the little transfer button to make it go into the section. So this is basic note navigation. You just scroll through. If I was doing vitals, if I wanted to do follow-up instructions, see patient back 2 weeks. Every encounter works the same way. It's just which encounters you generally use. So that's what we'll stop at right now. Okay? So I'll just put some stuff in here. The most important thing from the prescriber's perspective, if you open up the left-hand navigation bar, this allows you to navigate this clinical chart. So a lot of people don't like scrolling it because it's too hard to find your section. So if you just go over and click any of the sections over here, it'll bring you right to that spot. So if I want to go to follow-up instructions, I want to go to the safety plan, I want to go to social history, what it does is it just takes you directly into that section. Okay? Now the most important part generally is assigning an ICD, assigning a CPT, and ordering your meds. I think you guys mostly do it from an encounter. Each group I've talked to is a little bit different, but assigning ICD, assigning CPTs, and ordering medications is all done in the last little area of each encounter that's called diagnosis. When you go into diagnosis, this is your pick list of everything in the database for CPTs, ICDs, ordering medications, all of that. When you click the diagnosis, you'll see we have medications, you'll see we have ICD, and you'll see that we have CPT. Okay? So I'm just going to go through and fill a couple of these out. I'm going to stop. We're going to come back in and do this all again. And then let's just kind of see if there's any questions related of completing the note. So for the ICD code, there's 2 primary buttons that you can use. You can use your super bill, which is pre-configured, which is the little white box, or you can just pick from the ICD-10 code book, which is the green. Same for CPT. These are your CPT codes specifically. If you want to pick a different CPT from the master CPT code file, click the green one. So I'll do one of each. So for the ICD, what I'm going to do is just click ICD. I know it's a substance use disorder. I'm going to diagnose F16.10, and I'm going to say add the list. Then for the CPT, I'm going to click the green button because I want to search the whole database, and it gives you a little search bar at the top instead of just a checkbox of certain items. And I'm just going to type in, show me all 908 codes. Or we could even do 992. I don't know which code you're generally using. But let's say I want to use 99213 or something. So I'll use 99215. Add the list. So now what I've done is I've added a CPT and I've added an ICD. Same thing with the CPT codes. I can just pick it from your list if that's what you guys are used to doing. And I can hit add to list. So either way that you do it, it's just adding a bunch of CPTs and then a bunch of ICDs. The last thing is going to be ordering your meds. So we'll click our medication button. We'll click the button. We already did current meds inside of the encounter. Now I'm just going to do my ordering. So I'm going to say, let's order lovastatin for the client.
Is ordering med the same as prescribing a med?
It is, yes. So ordering is prescribing in our system.
Okay.
Okay. So that's actually a good question. So when you put the medication in, it's just the SureScripts database. You can type in anything. You can type in Zoloft. You can do, whatever med you're prescribing. You can do take orally 1 time a day for 30 days. So this is called your formatted SIG. I don't know which one you guys most commonly use. There's 2 options, the formatted SIG and a free text SIG. So you can type in what you want on the label, or you can use the formatted SIG section. Really, that's all you need to do in order to send the medication. Now, the common thing is am I going to do any refills? So is it going to be 1, 2, or 3 refills? I'll just keep it at 0 for now. And then what I'll do is I'll just hit let's save this to the client's chart. So you just hit the save button at the bottom. Sorry, my Lenovo database is telling me I should be doing an update right now. So what we'll do is we'll hit the save at the bottom. Okay. Now what happens is if there's any drug-to-drug, drug-to-allergies, and drug-to-disease interaction, you're going to get all those alerts that come up. And this client's on 40 medications because we've been using them as a test client for all the trainings. So it's basically giving you all of your interaction concerns for the drug and the interaction data with the effect with the side effects. Now, when you get this window, you have to confirm that you have reviewed the drug-to-drug, drug-to-allergy, drug-to-disease interaction, and then you have to bypass it. So you have to select something in the override in order to get past this screen. Okay? That's only when this comes up, and it only comes up if there's a contradiction in one of the meds to something they already have. So what we have now is Zoloft. So now I'm going to go back and do this all again, but I'm going to show you a less severe drug so we can go a little faster. I'm going to order a med. I'm going to pick aspirin for pain, and a heavy dose of 300 milligrams. Take once a day for 30 days, and that's all you need to do. Okay, and I'll just say we're going to take it as directed. And here's all of your lists. Take orally, 1 a day, 30 days, and save. So now that aspirin now goes to my list here of all my medications that now I can send to the pharmacy. So that's ordering a medication. Okay, now let's send it to the pharmacy. So I have 2 medications that I've prescribed, but I need to send them to the pharmacy. All you're going to do as a medical provider in your database is this is based on your username and login. I'm not logged in as you guys, but your name is going to appear here. The facility that you're at is going to appear here, and you're going to hit the submit button. Now, I can't submit drug medications out of your database. We have a test one. I'm going to show you the same screen, but I just want to make sure we're clear on this. So I'm actually going to stop here, go back, do it one more time, and then I'm going to complete this medication submission to the pharmacy. But I want to ask you right now, are you guys good with opening up your database, going to patient programs, finding the client, opening their chart, opening an encounter, and then going to the diagnosis section to do ICD, CPT, and medications. I'm going to do this a bunch of times, but just in general, does the workflow make sense, or do you have any questions?
I have a couple of questions. One is our current version allows us to use Dragon. I assume this also allows us to use Dragon?
It does allow you to do Dragon, yeah.
And the second, with the CPT code, yeah, the CPT codes and the ICD codes, Currently, when we double click on them, it auto generates that as a diagnosis in the assessment and the treatment plan up top. Do you know what I'm talking about?
Yeah, so let me ask you a question. So what you're saying is when you select the CPT and the ICD in version 7, and then you go to the treatment plan, it carries the CPT or the ICD data from your assessment that you're doing here. It moves it forward into the other encounter, being the treatment plan. It moves the data to that next section. Is that what you're saying?
It moves it into that section. It's still a part of the same encounter, but instead of us typing out all the diagnoses and then clicking on the ICD codes, if we just choose our ICD codes and double click on them, it auto generates a list in the treatment, in the, actually the CPT goes into the assessment box, and I have it backwards. ICD codes go into the assessment box and CPT codes go into the treatment plan.
Okay.
So that we're not struggling up under work.
Yeah. Let's just test that. So which encounter do you generally do first? Am I in the right encounter? Is this the one that you generally do, a medical encounter, or do you do something different? Let's start with your encounter.
Yep, so we're in a medical encounter, you're in the correct encounter, and then down in the diagnosis section,
yep.
You've got your ICD code list.
Okay, so I came in here, I picked my ICD, I transferred it into the note. So once I do that, okay, down here at the bottom, I have my diagnosis codes. Now from, oops, sorry, wrong one.
Okay, so there it is. So that 41.9, it auto, like, see just above an assessment and treatment, right below the diagnosis label, how it says anxiety disorder, comma, unspecified?
Yeah.
That's what I'm asking is, do we have to separately type that in assessment, or can, once we choose an ICD code, would it automatically generate in that assessment box?
It does automatically generate. Yeah, it does.
Okay.
Sorry about that. It took me a minute to figure out how to answer you, but
I don't
yes, it does.
Always ask questions very clearly.
I have a question as well.
Go ahead.
Is it possible, say we've seen the patient before, we've already identified their diagnosis and we see them for a follow-up, is it possible for the diagnosis from the previous visit to carry over, or do we have to re-enter them for every note?
Good question. So that's something that we added into the slide called the golden thread. And basically what we do is we take your first assessments, so your first medical encounter, as well as like the admission encounter, which generally is like a biopsychosocial or something. We generally start with the first encounter where we get diagnosis code, we get family history, medical history, social history, and then any encounter that has those sections in later, when you open up those future encounters, not the same encounter, different encounters, the diagnosis, the medical history, the psychiatric history automatically populates into those notes so you don't have to re-enter data. I'll talk to John about which sections he wants to add, but the diagnosis is probably the biggest one. Is everybody wants, if you put diagnosis in once, they want it to go to every note in the future, and it does.
I have one more question. So say I do an assessment on a patient and then a psych eval, and then Julie sees the patient for a medical reason. If she opens up her note, does the stuff from what I have then populate into hers? And then my next question is if we both have if I have a note, she has a note, and then I'm going to follow up after that, does it pull the information from my note or from her note if she changed it?
Good question. So it depends on how you want us to set it up. When you open a future note, a future encounter, it'll always pull from the most recent data in that section. So for example, if we look at family history, okay, and let's say, let's do something just a little bit easier for me to explain. How about social history? I just want to see one. Let's go in and do this one. So let's say I'm doing a specific social history section, and this can be for any section. And I said, yes, they're married. They've been married for 4 years to, John Smith. And I say happy marriage, okay? When I save and transfer this, this is the last thing that's been entered in any notes for social history. So if you open up, let's just say, a psych eval, and you want us to map social history from previous, it'll always map back to a specific encounter. So we would map it from the medical encounter, and it would always be the last one that was updated. So if you started it 3 weeks ago and then she updated a week ago, it's only going to pull the most recent update to that social history section. It doesn't determine in the same type of notes if we're pulling from a medical encounter to a psych eval. It doesn't look at what did Julie do and what did Shoba do. It looks at what was the last one that was done. And the only way we move the data is if you're doing a medical encounter or a biopsychosocial or whatever counter you want to move the data from, whatever you put in this one, when you save it, okay, so we did social history, let's do past medical history, heart disease, okay? In any other encounter, so if I go up in the all button, there's a psych eval, a psych follow-up, discharge encounter. If we say we're going to map the data from the medical encounter to the psych eval or any of the others, it's always going to come back to this section, and it's going to pull this section and move it into your current notes. So when you open up the psych eval next week, whatever was done in this medical eval a week ago, and if there was 3 of them done, it would be the most recent one. It's going to look to this section and pull that forward for your new notes. That's the way it works today.
Thank you.
Yep. But I can map any section from a previous to a follow-up. And if I don't want to do that, the second thing you can do is you can do, I don't know if you guys use the derive feature, so I'm going to sign this note. So if we say we're done with this encounter, we ordered our meds, we did our, our safety plan, whatever, we hit the save button on the right-hand side, which is the green button. Now I can sign it. In order to sign a note, it's the big orange button in the middle that says unsigned. Click it, and your signature will populate. For now, I'm just going to hit OK. If it's a billable charge, if it's like a client in residential and it's all bundled services and you don't bill this, most of our clients just hit the OK button. I'm signing it, but I'm not billing this as an ancillary service. It's just part of their 30-day stay in residential or whatever. If I want to bill it, if you use the current bill button in version 7, you're going to use this same bill button here to bill the charge immediately. For right now, I'm not going to focus on that. All I'm going to do is sign. Okay? Now, you had asked about Dragon, and I'm going to show you another feature called Derive. So anytime you do an encounter over and over, you can derive from the previous encounters if you want to copy the data in. Do you guys ever use that in your current version?
We had the drive taken away from us a couple years ago.
Okay. I didn't think anyone was using that right now, but up here at the top is something called, let me show it to you. So I'm going to open it up, do a medical encounter, and say, let's open a new one. So I'm going to select medical encounter, hit the plus sign, validate it's me, and open up my new note. Now all this sign note's going to go away and a new one will open. So now I have a clean new encounter to do. It does hold all the current meds and allergies. Up at the top is something called encounter flow text, and this is where your Dragon's going to work, where when you turn on your Dragon microphone, same way as version 7, the flow text is where you speak it, And then when you say a transfer, it transfers it into those sections of the encounter. It's the little button up here that says Encounter Flow Text. That's your drag-in feature.
Okay, how did you get it from the flow text over to the, what did you click on?
So let me move the go-to meeting. Okay, so I want to use drag-in for this encounter. You open the encounter, click the little button at the top, click in a section. These are all voice-driven, so just say CC and it opens the box for you. You'll speak your section, HPI, speak your section, ROS, speak your section, physical, speak your section. And then when you're done, I think it works the same in version 7 unless you're using a mic controller. You just say transfer. And the drag-in system takes the data from here and maps it into the appropriate section of the encounter.
Okay, that's what I got lost on, how you transferred it. I didn't know if there's a transfer button, but you just say the word transfer?
Yeah, that's how, I don't know which version you're using, but all of our clients that are using drag-in today, it's voice command and you just say transfer.
Oh, we have a transfer button.
Okay, perfect. Same thing. Okay, so let's go out before I get too complicated and just make sure that we all got this. So generally, are you opening encounters from appointments in version 7, or are you searching for a patient and going into their chart and then deciding what to do? What's each of your general day like of how you go into client charts?
Typically, we open from an already scheduled an appointment. But say like someone calls and says, hey, that medication you gave me yesterday made me really nauseous. Can you call me in a script for Zofran? Then we need to go in and create a new encounter to send a script for Zofran because they don't have an appointment that day. Does that make sense?
Yeah.
So we do both.
So there's, yep, couple ways that you can do that. And I don't want to make it more complicated, but a lot of things we did in cloud were meant to make these things easier for you. So let me show you a couple ways how you would handle that task. So if you remember, this timeline over here is a very important component of the new cloud database. And what it's meant to do is give you the ability to quickly review old work. Okay, so if you took that phone call, you could quick grab your last encounter and see what you did. Okay, but it also has the medication log button in it. So even if I'm not in the chart, and we'll use Mark Patrick as an example, let's say I log into the system and I take a phone call for Mark Patrick. So I go to my patient programs, I search for Mark Patrick, and he put a Z in front of his name, so I'll search Z Patrick, open up his timeline. I didn't go into his chart, all I did was just open his timeline. I review the medical encounter I did yesterday, see what we did. Great. Let me do this one because this is the one we just did. So here's everything we just did. Here's the note. Here's the past medical history. Here's the heart disease. Here's the social history. Okay, so there's that note we just did. If I need to modify a medication, I can click the medication log button. This is the big one. It may work for you phenomenally well, or you guys might decide you want to just stay doing it your way. Either way is fine. But this medication log is a quick way to change a dose, edit a dose, send a new script to order a med. What it does is it opens up the SureScripts database without having to go into the client's chart, picking a medical encounter or a medication encounter. You can do it right from the home screen. So it's a quick access to medication management without having to go in and do the note. To actually go into their chart, pick the note, hit the plus sign. You can do it right from the home screen. Okay. Now, if I wanted to, for example, edit the medication, let's just get this out of the way. Your options for these medications, so I prescribed aspirin, but I need to edit the medication. I can hit the edit medication. I can stop this medication. I can renew the medication, which is the green one, or I can refill the medication. So these are the 4 button options on the right. The other one up top is the medication log that shows you the history of how long they were on each medication, what's been discontinued. So if I want to see all stop meds or any renewed medications or refilled, just remember the medication log button shows you the whole history on the client's chart. Okay, current meds, allergies, medication log, and order medication. These are your options and your features once you've prescribed a med of what you can do. The only reason I'm showing you this again is because you can now do it from the patient timeline instead of having to go in and open an encounter. But let's say I wanted to do it the way you suggested, and let's say I want to go into his chart. So let's go in. We did the review. We're not going to use the medication quick shot. We're going to go into his chart by clicking the little link under the bottom. We'll hit the all button, and this time we're going to do a medication encounter. So I click medication, always hit the blue plus sign to do a new one, and hit save. Okay? So now I can put my notes in, patient stated chest pain from medication, whatever. Okay? I can update current allergies and current medications underneath. Okay, so these are my current meds. And then inside of the chart, since I opened a medication note, I still have to access this little blue medication log here, or I have to do it from the diagnosis code section. So because there's no diagnosis code section in this note, I can't open it up to do my medication inside of all that pick list I showed you earlier with the CPT and ICD. So you have to use the little medication log in the timeline to go in and say, I'm going to edit this dose. Okay. We're going to change, you'll see here, the 300, say we're going to up it to 3 times a day. Okay. Now what I'm going to do is show you how to submit these changes of orders in original scripts, which is going to be this part here. I just have to jump over to my database. It's going to look the same. But just from navigations, getting to the medical encounter, getting to the medication encounter, finding a patient, getting to the medication log, which is the very important one, this blue button here, or you have to do it from an encounter that has, and I'm sure you guys know your encounters probably better than I do, you have to do it from the diagnosis code section. So the diagnosis code section has the little thing in here called medication, which is your standing orders, ICD. So this little box here, medications, here is the same box. If we just want to close this out, it's the same box that opens in the quick link for the medications on the right-hand timeline. Same thing. Order your med. Take orally, once a day, 30 days. No refills. Save. That unit's fine just for the test. Okay, select it, and we're going to hit the submit. Now I'm just going to pick it up in my database so I can send to a test pharmacy. But just getting into a client's chart, opening a note, signing a note, using the timeline. Any questions?
No, I don't think so.
Okay. We're going to touch on a couple more things when we're done. So all I'm going to do, and you can watch me do this so you know why I'm going here, I'm going to open up my database right there, which is the same as yours. Click my yellow button. Log in. Open up the left-hand navigation bar, go to patient programs. I'll have a list as well. I'll select my client, Billa. I'm just going to do it right from here with the quick link and hit medication log. Going to order a med. Just stick with the lovastatin. I'm on a roll with that today. Save. Reason. This is a turn on and turn off too. Some of our clients require that that you have to put the reason that you're prescribing the med. If you decide none of you guys need that, we can turn that off. So now I have my lovastatin ready. You will default to your name in here. It will default to the person who logged in and the location, and you'll hit the submit button. When you hit the submit button, here's the script. So if you were to print it out on a paper script, here's everything that's printing out. Client's name, provider's name, medication, strength, quantity, supply, directions. The pharmacy is already attached. They already have told you that they want all their medications to go to CVS. If there is no pharmacy listed here, you would click the little purple magnifying glass, type in whatever you're looking for, city, state, and zip, doesn't matter. I'll just search for all CVS's near me. Okay, I'll pick my pharmacy. It added that new pharmacy here. From there, I can hit send medication. It will give me a confirmation that the medication has been sent. Missed the button. Good. You should see something on the screen that says one medication has been sent successfully. And I'm going to hit yes. I'm happy with that. And then I'll just go back here. So in this case, I never even went into their chart. I didn't open up a medication encounter. I didn't open up a medical encounter. I just did a script directly from the medication log folder on the right-hand side. If I want to do that from an encounter, if that's the way you always know what encounter that you do, I'll just this time, same patient, I'll select Phila, and this time I'll go into his chart by clicking the little link underneath. The link takes me into his chart. I'll click my All tab. I'll say this is my database, so I'm just going to pick an internal medicine one, for example, or miscellaneous note. Okay. I'll go in, I'll answer all my questions. If I wanted to do it from here, I can click diagnosis at the end of the encounter. When I'm done documenting the note, go to my medications, which is the little blue button there. Order my medication. Same thing, I'll do the lovastatin again. Well, let's do something different. Zoloft, 25 milligrams. 1 for 30. Save it. Now, what mine's going to do is mine is now going to do drug to drug, drug to allergy, drug to disease interaction, and found a contraindication. Hit OK. It will default for you, so you don't have to do this step, and then I'm going to hit submit. When I do this medication, you'll see the script pops up, the drug of choice, pharmacy, send. I have a couple here, so I have to pick which one I want to send it to. So that's general workflow. Although I can't show you in your database, I want to make sure that wasn't too confusing. Do you have any questions about that?
There was a question that came up with Dr. Plum, and I think I see it. When you're writing prescriptions, our current version, you can't write a prescription to be filled in the future, but it looks like there's a start date.
You do have a start date now, correct?
So that would go to the pharmacist?
Yes.
Okay.
So I think my understanding, and I'm not the I'm not the prescribing expert. I have a couple of people that do that probably know a lot more than I do about it. But the start date basically is telling the pharmacy that they can't fill. That's the fill date when they can fill and release it to the client.
Okay, that's what we were hoping for. There's 2 instances where we would need that. And one is like if we're titrating someone, we want them on, Lexapro 5 for 1 week and then start Lexapro 10 next week. We could write that future prescription without having to remember in 7 days to get back in their chart.
Right. Yeah.
And the other situation is if we want someone, say they're on a controlled substance like Suboxone, to only get 7 days worth of meds at a time, but I'm going on vacation next week, to write that future prescription without having to take my computer on vacation with me.
Right. So what you want to do in that case is, I'll just do it from the medication log. We'll stick with this guy. And then I'll do Suboxone. Sometimes this, in my little test database here, I think it would be the film, but sometimes it won't allow me. I don't put the script right, and it doesn't allow me to save it. Let's see if it allows me.
So is that where you would put the start date in that screen?
Yeah, so yeah, hold on 1 second. I'm going to just kind of make sure I can do this, and then I'm going to cancel it before I send it. Okay, so here, now that I have it in, my start date is right here. So I'm going to say this starts on the 30th or whatever, if this was the second one. But this is the place where the effective start date's going to be. That's your fill date. So if you wanted the second medication not to be filled before next Thursday, and I'll just verify it, but I'm 99.9% sure the start date is what a lot of our medical providers term the first fill date.
Okay. Yeah, we just want to make sure that that would get to the pharmacist. I see that there's also a note section for pharmacist, which we use occasionally, but not that often. It'd be nice.
And you also can add the little, anytime you see a little green button, if you just get into the system and click around, and I'm not saying you guys won't, a lot of this stuff is easier once you just start clicking on it, but the little green buttons, that just allows you to add your own notes into the system if you want a pick list of things that you commonly say to the pharmacist. Otherwise, just type it in. Okay? So then we'll hit transfer. So now I have all of my, go ahead. Sorry.
So on the prescription, So on the prescriptions that get sent, does it have both our NPI and DEA number as well as Dr. Plum's, or is that, because like for the Suboxone, like I've had to have like insert her info into it.
I think that's something we have to work out with the EP something people, right? John?
Yeah, so let me come back to you on that one. So the other thing is, let's take, let me just pick a different medication here. So take a Lilly one for 30 days. And then for whatever it might be, let's hit save. I'm going to start this one today. One of my providers is set up previous medication, other, save. One of these providers is set up, I think, for EPCS, where it should give me my 4-digit code. It's not giving that to me. Why is that? So just so you know, for anything controlled substance that you're doing, when you pick a controlled substance and hit the submit button, you're going to get a little box that comes up right in the middle here. And what it's going to say is request OTP PIN, and the little box is just to enter the PIN. So the new way it works in the cloud, it sends the PIN code for the EPCS submission to your cell phone, to your mobile phone as a text message. And it lasts 30 seconds, and then you have to request another one. I was trying to see if I could get one to come up in the sales database here. Let me just try someone different. Let me do this Suboxone, and then let me submit that. There we go. Okay. So what you'll get is this little box that pops up, and it's going to ask you for the password. When you hit the button that says request OTP, that's going to go out to the drug registry, request the PIN, and then when it sends it back on your mobile phone, you have 30 seconds to enter it into this to bypass it so you can release the med to the pharmacy.
Jim, in our current system, we have to, if we write a controlled substance that's not buprenorphine, we use our normal DEA number. But if we write a buprenorphine like Suboxone or Subzol, we have to switch it. There's a drop-down box where we go for our regular DEA number to an XDEA number. Will we be able to make sure that that's all set up and ready to go before our go live date so we're able to get scripts for everything through?
Yeah, so let me make sure, I'll take a screenshot of that. I did not set this up, but let me make sure that I just understand. What you're saying is under the information here, you switch this DEA number depending on the medication?
Yeah, if we write for Suboxone or Subzol, instead of LK and then those digits, it would say XK. And there's a drop-down box where I can choose. So mine are either MW or XW. I have to choose depending on what I'm sending. I'm sure yours is the same, right, Shoba?
Oh. I've never done that, so I'm probably doing it wrong.
Well, is that why they're requesting Rachel's XDE?
No, they told me that I've been told that I have to have mine and hers. It's certain pharmacies are picky about it.
Sometimes they used to ask me a little bit, but now that I have an XDEA input, I just put in that number and I've never had to give that information. But I don't think it's a bad idea to have her information pre-printed on all of our scripts anyways.
Yeah, I mean, they do here at Munson, like for the discharges. So I know it says on here DEA number and then CS DEA number. Is that potentially where we could have like an XDEA number put in?
That's a great question. Yeah, that's a great question, and I actually do not know the answer. So I'll come back to you on that one if it's okay.
Yeah,
I do know.
That would be nice if they both just showed up so you didn't have to worry about switching them back and forth.
Yeah.
Right. And I'm just making some notes in cryptics with my mouse.
Sure. Shoba, is it because you're an NP that you need Rachel sometimes?
I don't know. I have no idea. So I just put it in the notes to pharmacy. I have it like on a Word document and I just copy and paste it in there. And I just put it on all of them just because, so I don't get.
Gotcha. What do you need scissors for? Sorry, that was my 5-year-old.
If you and Manny or your guys' team members need to go over this at any time, just let me know. I'll set some time aside so we can get this set up.
Yeah. I think we should definitely do at least a 15-minute review call. Manny will know better than this because he did all this setup of this database conversion, so we'll let him answer that one.
We also had to each individually sit with Manny over the phone for an hour to get our prescriptions abilities set up, like so that it linked to our cell phone. So we need to make sure we need to schedule that before October 6th as well. So we should try to do this.
You're talking about the token setup, Julie?
Yeah, the token setup, but it also, we were able to download the Authy app at the same time.
Yeah, we've got some time slated for that. I think it's next week.
Okay. Well, Rachel and Shoba are really tight on their schedules, so you're going to want to schedule with them sooner than later.
Right. I'm just looking for the email right now that I just got.
And when you gave me the example as the DEA number, the DEA number, you had to switch between two just so I can pull them. Can you tell me which two, what two letters did you use for the DEA number? What were the options?
Well, on this example, it says LK, and then there's a 7-digit number. You would, if this provider, this Dr. Kuchimonchi, would be XK, and then the same 7. At least that's how my DEA number is MW followed by 7 digits. And then my XDEA is XW. So you just replace the first letter with an X, I guess.
So I'll put the things to make sure that. Okay. So we are going to want you guys to navigate. So I'm going to take 1 minute. Just do it one more time quick. We're going to let you guys go in. Make sure you know it. The first week of your go live, we're going to have a 1 to 2 hour window every day where you guys can just come in if it's not working, you need help, you don't remember how to do something, where every day you can jump in and talk to me or one of my teammates, and we'll make sure each day of the first couple you're getting all your scripts out. Okay? All right, so let's do it one more time. I'm going to be in your database, and I'm just going to log off and log out. Click to log in. You always have to hit the yellow button. We'll come up to the top. Log in. You don't need the second one. To find an active client that you just want to go in and edit or add a med, you can go to Patient Programs. So search your patient at the top. We'll stick with Z Patrick, ZP. Here's him. He's in Dekoski, which is, I'm assuming, is an inpatient facility, I think. If I click on his picture, gives me his timeline. I can see all the work we've done. I can open up the previous encounters, do whatever I would like. If I want to edit a med, there's a little button on the left-hand side, on the right-hand side, if you highlight it, called Medication Log. That will pull up the e-prescription system.
I think we're stuck on the previous screen, Jim.
Oh, no. Let me try again.
Looking at the...
I'm going to refresh the go-to meeting. Do you see Z Patrick?
Yeah, that's better. Thank you.
So I won't log all the way out this time. Let's just say we just logged in with our username and password. We go to Patient Programs. We click the patient search at the top because you have 1,000 clients in here. We don't want to scroll through 20 pages. We just look for everybody with the name of Z Patrick. I found Mark Patrick. If I want to just see what we've done previously, highlight the right-hand side. Here's all the work we've done. If you want to see the previous encounter, just click the little symbols at the next to each encounter, and it'll open it up for you. It's just a double click. If you want to edit a medication quickly, you would click the medication log, select the medication, edit. If you wanted to order a medication, order a medication. If you wanted to add a current medication, add a current medication. I'm going to order a medication. I'll select order, put in the medication, select it, route, dose, date range, start date, which is the fill date. We'll say it's tomorrow, and we'll save. Okay. It will ask you for a reason. Let's save. I have to close my database behind it. Okay. Drug to drug to allergies, you have to bypass this. You cannot skip over it. We'll take that medication, select that one, submit to the pharmacy. Your name will drop here based on your username and login, and we'll submit. If I don't want to use the medication log and I'm actually just working from a scheduled appointment, when I log in, I will see my list of appointments for the day. The top, this is a hidden search bar. It doesn't necessarily say click here, but you can filter what you see on the screen here. So if you click the appointments button at the top, I could say just show me everything for today. Let's just do a couple days, 9:15 to 9:22. But instead of being everybody, this will always default to you as your provider. I can see everybody's calendar. Let's see if Henry 7 has any appointments. So Henry 7 has like 10 appointments this week from that date range, from the 15th through the 20th, second, and hitting search. I'm going to throw a new appointment, one that we haven't done, so I'll just use me. Adam Woods is my son. and we'll say the location is at the Koski, or the provider, doesn't matter. And then this is just for training purposes. You will not schedule an appointment through this little appointment button. So let's see what that, cannot create appointment for an inactive patient. Some of the test patients we made inactive who we were using earlier in the session. So let me put a test client in, AA test. Now you don't have to use this to enter them. You're going to use your standard Medix Premier scheduler if you schedule appointments on your own, just the S tab at the top. But when I log in the morning, I have one appointment for today. It's with AA test with this provider, with this location, this type of appointment. If I want to get into the client's chart from my home screen, my initial login screen, hit the open button, what type of program this is for. So we'll say outpatient, and let's say we're doing a medical encounter. This template we kept the same as version 7, so this should look somewhat similar to you. This workflow is all the same. And then when you hit OK, it'll open the encounter for you. The difference between doing it from the appointment and doing it from My Programs is My Programs takes you in but doesn't open an encounter because you have to go into the chart first and then find the encounter. The scheduler basically says, okay, the client's here for outpatient. What note do you want to do? And you pick it from the scheduler. At the end of the day, it takes you to the same thing. So this one automatically opened a new encounter for you. You would do your documentation. Open up your left-hand navigation bar. If you like to just quickly jump through section to section, this moves much faster. So I can jump to any part of the note to document. When I'm ready to complete the note, I will hit the Diagnosis tab. I will select the ICD code by clicking the white little folder, add the list, CPT code, add the list, medications. Again, I can do this one from the medication log, but if I want to do it in here, we'll do lopestatin. Once a day, 30 days, save. Select that medication, submit to the pharmacy. Now when I click this, it's going to say I'm not a rendering provider because this is your system, but your name will pop here. You hit submit. Okay. We're a little over 2:30. I think I have one more training left to go, so I'm going to stop there. Is there anything critical that you're going, I have no idea how to do this, or he didn't show any of this that's important to me? Is there anything that you need me to touch on quickly?
Yes, so when we're done with our notes, we forward them to our supervising provider to review. How would we do that?
Great question. So remember when I said if you're signing individually, just click your unsigned button at the top and it populates your signature, you hit OK, and what it does is it signs the note but leaves you in their chart. If you hit the purple button, it signs the note, but it takes you back to your calendar, your home screen, so you can open up your next appointment that you have and just start to work. But if I need to route this, there's a button at the top called Signatures that sits right next to Unsigned, and this is your routing mechanism. So if you click Select Signatures, it's going to say who of you is signing now, okay? So I'll say, for example, in this case, I'll just say I'm a provider. This would be backwards, but I'm Henry. I want to sign this note. So I click the signature and hit save. I signed it. But now I also need to route it to somebody else. So let's say we're going to route it to Shoba. I'll just pick an S, whoever comes up first. Okay. When I route it to Shoba, it's going to send this document to her. So what I would do is hit the little blue pen, and it's going to send this to her for a second signature and review. So the signatures is the routing mechanism in the client. Now, I'm going to show you how it works, but I'm going to send it to myself because I'm logged in as me, so I want it to come to me. So I'm just going to assume I want to route this to Dr. Henry 7. So I pick Henry, and I'm going to say send to him. It's going to give you a notification that the document has been forwarded, message sent successfully, okay? And this was for AA test, and this was a medical encounter, okay? So now when the rendering doctor or medical supervisor comes in the morning, what he should do is open up his left-hand navigation bar, because this is how you navigate the whole system. Go to his inbox to look for any documents that's pending his signature and review, and you'll see a little button that says pending signature, and there's one new one here. Here it is. So when I click on it, okay, this is the new document that was sent to me from that other user. So I click pending signature, select Henry 7, and you'll see it linked it to this patient, to this provider. It's pending a signature, the date it was sent, and then the way you execute them is these two little buttons here. So if I click the little stethoscope, which is the general function to view a completed encounter, it opens the encounter, and then there's a little signature button at the top to apply the second signature, and here's that guy we sent it to. It's the same screen. Now he's going to sign. Now you have two signatures on that. That was kind of fast. I probably should have covered that earlier. Do you want me to do that again, or was that clear? Was that good and clear?
That makes sense.
Okay. Just remember, whoever you're routing to, if they call you and say, I don't see it, because I'm sure there's some people who didn't sit in some of the meetings for routing, anything you're routing through signatures goes into pending signatures in your inbox. So if you go to your inbox, anybody who's being routed notes for second signature, they will sit in pending signatures right here. And then you go back home. Okay. If you guys forgot to ask me questions, and it's super important, I think the day before, I'll probably have some open time with you guys where anybody can jump in and ask questions just day before last minute prep. So if you guys feel you're doing your job in Doc Assist and you realize, oh, I forgot to ask about this, just come back to the last day before session. You can just jump in and get right back out.
All right, thank you.
Thanks,
Okay.
Jeff.
Yep, we'll see you. Have a good afternoon.
Yep, see ya.
Thank